Good morning, evening, and afternoon to everyone. I'm here to present Medkit. Medkit is an IT platform that supports, it's an infrastructure built to support pharmacies with financing for their inventory, as well as data management systems. The overview of what we do, basically it's just accelerating community pharmacies. So we map out pharmacies that would like to partner with us and clinics. We give them stock financing, a point of sale or pharmacy, hospital business management system. We offer them coaching and consultation because we are experts in this sector. We've been mostly working with startups, but there's opportunity to work up with already established pharmacies. Some market statistics about the Kenyan market. We have a population of 50 million. 80% of the 5,000 pharmacies and 10,000 hospitals and clinics don't use a standardized smart data collection or data management system. So what then happens is they are not even able to access, they're not able to do proper forecasting and quantification, as well as access funding for expansion. And of course, this number is just for the registered pharmacies and the clinics. The number is even double this of the actual ones on the ground in need of this solution. The pharma market is $1.5 billion US, and that's in the Kenyan market. And of course, the East African market then brings us to 7 times that. The expected impact of using our system or our partnerships with the pharmacies that partner with us is they have timely data to do their medication and interventions. They have improved essential medicines and vaccine supply chain security, especially during this time of COVID, because now data is there and they're able to forecast and track. There is efficiency in collaboration with other healthcare workers, referral. The data is just, the patient data is portable. There's improved medication use and disease surveillance. There is also reliable operational data for business operations and sustainability, or even financing for startups to expansion. Because one of the things we see in Kenya is that every year 1,000 pharmacies never see their first year anniversary, and the reason mostly is because just the data is not even reliable. The team, so we are 2 of us. Of course, we have employed project team, development team. So there's myself and Edwin. Edwin is based in the US, so he supports us remotely, and also he's a shareholder in the business. Details, our revenue model is we have 5% that we charge on the cost of sales. We have multiple ways of growing that. In return, we give them a uniform pharmacy management system, branding template, medicines, and the best market for their pharmaceuticals. Our advantages is we don't ask for collateral, like what is asked by many other people in that sector. So our competitors with Helium Health out of West Africa. We also have Access also in West Africa and East Africa. And the market is huge for us to do what we are doing right now. So the partnerships that we are looking for right now, I founded the largest corporate chain of pharmacies in 2007 and exited that in 2019. I've been now using that expertise to consolidate into the system and structures. So what we are looking for is maybe an early stage investment partner who can offer technical assistance, mostly even just for packaging what we have in readiness for attracting scale and Series A type of funding. So those are our needs right now. Yeah, thank you.
Okay, thank you so much. And Q&A session, dear judges, be active, they are worried. Okay.
So do you guys have clients already?
Yes, we do. We have 20 clients on the system, and 3 of them that we are funding for their entire stock needs. The rest just use the system as just for managing of their data.
What is the equivalent of your funding to your clients?
The funding that we have out
in terms of money, if you equivalent that to translate to money.
Also, for the 3 that we have right now, we have close to 40 US dollars, yeah, 40,000 US dollars. Sorry, and remember we started funding this year. So it's because we managed to bring up the system to a point where we are able to collect the bankings every day in the system, and we're able to be paid from that. So yes, that's how much we've put in so far. We are willing to put in more.
How much have you guys made so far as a company?
Sorry?
How much have you guys made so far?
So we out of that, we levy a 5% margin on the cost of sales. So we haven't really been tracking how much we've made, or so to speak, because at the moment we've just been sort of piloting it and tracking and seeing, is it meeting the needs of these pharmacies? And remember, they are startups, yes.
And you guys are also startup?
Yes, for this particular venture, yes, we are startups, and the pharmacies that we are supporting, because of the, we were just interested in just finding out testing the model to see if it works. So, and we found that it actually works. There's uptake, and the users are finding benefit of it. Yeah.
Is it a model that can scale beyond Kenya?
Yeah, sure. Yeah, it can scale beyond East Africa. Even in West Africa, we know Helium Health are doing it in West Africa. Of course, East Africa is a unique market in itself. So with our expertise in this market, we actually have a better place to scale within East Africa for this solution.
Okay.
Thank you. And we have like 10 seconds for a question. Dear judges, do we have to move on?
If no one doesn't have any question, I would like to ask him about his competitors.
Yeah, sure. The competitors at the moment is Helium Health and Farm Access. So the difference that they have, so Helium Health have a pharmacy management system and a hospital management system, and they lend against, if just from the data that they have collected, they're able to lend against that. So we, on the other hand, have been, for the last 15 years, we've run pharmacies, community pharmacies and clinics. So we've moved from that area, and now we're coming into the area of sort of coaching and supporting and mentoring these pharmacies and clinics to sort of scale the challenges of doing business in Africa. Yeah.